She'd been to the neurologist and had like $1 million workup for multiple sclerosis, all negative. And it turns out peanut in her medications, right? Today, we have a panel for you. We have some top functional medicine physicians and nutritionists, and we're going to be blowing the lid wide open on food sensitivities. Are they legit related with certain symptoms, certain diagnoses? Are they real? I want to ask you guys a question. What has been one of the most shocking cases or transformations that you've seen so far? I'm curious. I have a story, but Dr. J, I think you were getting ready to tell a story, so I'll have you go first.
Sure. Yeah. Thanks. I love this story, this case, because first of all, it involves a young child, a 3-year-old named Noah. And what I like about it is that we don't see really a placebo effect with kids, right? I mean, especially a 3-year-old. So the parents were very frustrated with their, general medicine. Little Noah had a chronic cough that was really rough and had I'm just going to call it a dermatitis or an eczema, but it just was really all over his body. It was dry, it was itchy, it was irritating. He wasn't sleeping well. I mean, he's just really uncomfortable. Poor little 3-year-old Noah. They had gone to allergists. They had gone to infectious doctors. They had gone to dermatologists. And essentially, I think between antibiotics, for the cough and probably, an inhaler of some sort, and then some topical skin, steroids, I mean, this is like general medicine treatment for this young little boy. And the parents just said there's got to be something else, right? So, we ran the testing, worked a little bit, with his diet, helped with digestion, and, eliminated basically for him, his big red flags were gluten and dairy.
That's
and,
it. Not everything.
That was it. It was gluten and dairy. And the parents jumped right in. The whole family eliminated gluten and dairy to make it easy for little Noah. And I'm happy to tell you that the skin cleared right up. I mean, he has just the healthiest skin ever. His cough cleared up. He's 4 years old and he's doing great.
Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. I have an incredible story. Melissa, 20-year-old from Australia with POTS and dysautonomia, completely sidelined from her college career, right? And essentially, we did all the testing, and guess what it was? I mean, crazy. You think crazy. It was, and I have video of her getting this result, honey, and sitting behind her was an entire wall of honey buckets behind her. They own a honey farm, a bee farm. That was the only actual thing that showed up. And within 2 weeks, her POTS and dysautonomia symptoms were gone.
It's amazing.
Right? It's healthy. It's honey. Right? And she didn't have to eliminate anything else. It was honey. Right? What about you, Kathy?
So I actually, we have a current client who had a big aha moment just the other night when we discovered that she was taking prometrium, which contains peanut oil, right?
Peanut oil. That's the other thing is your medicines can actually have allergens in it. I was talking in a mastermind call, in a training call, talking about hormones with somebody. And I said, "Oh, are you taking this medication, prometrium?" I was like, "Oh, that product is in peanut oil."
Yeah. And so she said she wasn't even fully paying attention to what you were saying. And then all of a sudden was like, because she had just gotten her food mapping results back not too long before that. And it was like this huge aha moment. She's been going to neurologists. She's had numbness and rashes and pain and all kinds of things. Hives. And she's been she's basically been dosing herself with peanuts every day.
Well, she said she was getting numbness on her lips and on her chest, and she'd been to the neurologist and had like $1 million workup for multiple sclerosis, all negative. So several years of this or months of this, and it turns out peanut in her medications, right? That's a dramatic story right there. Allie, what about you?
Not as dramatic, but speaks to the, if you're doing elimination, so there are certain foods that we know are historically allergenic, gluten and dairy being two of the top ones. And so it's easy to say, okay, without looking further, let's take that out since you're consuming that a lot. And so a client, Jack, who had a lot of like distended stomach and like a combination of constipation and diarrhea, snoring, like not sleeping well, really fatigued, weight gain. And so didn't see a lot of movement, some definitely improvement after removing gluten and dairy. But then we did the test and peppers came up, bell peppers came up, oats and rice. And oats and rice, two things that are in a lot of the gluten-free foods, right? And bell peppers were something that he really prided himself on, having like a rainbow of bell peppers. And once he eliminated them, no more snoring, lost 15 pounds, digestion, so it was a combination of all of the things. But it can be otherwise healthy foods, which you alluded to before. It could be mango, it could be broccoli. These are healthy things you're eating because as part of a healthy diet, they're not healthy for you. And this is a very bio-individual way to figure out what your unique body needs.
To learn more about the food mapping system and my food mapping masterclass, click the link above or below this video.